Hi everyone, thanks for being here. I'm Alex, and today I'll be walking you through our conflict resolution plan specifically designed for our ABA clinic. This training is about real issues we all face, disagreements, burnout, and tricky situations with families, and how we can handle them professionally and confidently. Let's get into it. All right, so our training overview. Conflicts are going to happen. In our line of work, we're constantly juggling treatment plans, team dynamics, and family interactions. So this plan is going to give us a clear and structured way to respond when something feels off or tension is building. By using the plan, we're not just getting through conflict, but we're using it to strengthen our communication and improve client outcome. Here is what we'll cover today. At the end of the training, you should be able to spot the most common conflicts that we deal with. We're going to talk about three common ones. Know what action steps to take when these things do happen. Use prevention strategies to stop conflict before it keeps growing. And follow a clear flow chart if something needs to be escalated by your supervisor. Okay, so let's get started. Conflict one, staff disagreement on treatment. This is a common one. Let's say you and your coworker maybe disagree with a part of a treatment plan, maybe the prompting level or how reinforcement is scheduled. So if you're ever finding yourself thinking this isn't the right way, remember that it's okay to feel unsure, but the correct response to that is to bring it to your supervisor privately and respectfully. Don't ignore the program, don't do your own thing. Our plan calls for data-driven conversations and supervisor-led clarification. So using your supervisor as that resource and communication outlet is the best thing you can do in this scenario, right? Um, a way to prevent it could be weekly case review meetings, written protocols, and fidelity checklists. This could all really help with getting everyone on the same page so that we don't have this kind of conflict. Conflict two, caregiver disagreement with goals. Sometimes parents will push back on treatment goals or procedures, especially things like extinction or weight programs. As an RBT, your role is not to convince or debate, it's to remain calm and report the concern. Your BCBA or your supervisor will know what to do. Avoid getting pulled into emotionally charged moments. Your BCBA will handle this with data, collaboration, and sensitivity. But it starts with you documenting and communicating it clearly so that we're able to fix that issue. Some prevention strategies could be visual data sharing, which could mean like showing charts and showing different cases where this works and having parents really understand. Also, regular parent training and family involved goal setting is very, very important. Conflict three, RBT burnout and team dynamics. There are a lot of ways that this can happen, right? Especially in our line of work, it can be really draining sometimes, and that's okay. This might be a harder conflict to spot because it is internal, but when you're feeling stressed or burnt out, and this causes frustration, withdrawal, or tension in team interactions, it's important to take it seriously. You might see it in others as well, not even just yourself. If you see it in someone else, it's important to take that seriously as well. We want a culture where it's okay to ask for help and to talk to a supervisor privately. Recognizing the signs of this early on, like snappiness, isolation, low energy, that is key to keeping our team strong. Some things that we can do to prevent this are monthly check-ins with your supervisor where you are talking about clients, but you're also talking about how you're feeling, recognition programs, and balanced expectations. So I've talked about three common conflicts that usually occur, right? But here are some best practices for just across all situations to keep in mind. Using data to guide conversations, not opinions. bringing up concerns early before they build up is a big one. Being sensitive and respectful when talking to caregivers, watching for burnout signs in yourself and others, and if something feels off, checking in privately, not venting publicly. Following these help conflict stop itself from turning into a crisis. Okay, now that we've gone over all of our conflict types for this presentation, we're going to do a case scenario quiz. The first quiz question is, an RBT refuses to implement a new prompting hierarchy, stating that it is not effective. What type of conflict would this be? I'm going to give you a few seconds to think about it, and then I'll tell you. Okay. It would be B, staff disagreement on treatment, because the RBT is the one not wanting to implement a new prompting hierarchy. So this is just about identifying, right? Can you identify which conflict is what? Hopefully you got this one right. Let's go on to the next. Okay, case scenario quiz question 2. A caregiver becomes upset during a parent training session and says, "I don't want my child punished like that," in reference to an extinction procedure. They refuse to sign the updated behavior plan. Now, as the RBT working with this family, what is the most appropriate way to respond in the moment? Read the question, read the answers, and then I'll tell you afterwards. Give you a few seconds. Okay. If you said C, you would be correct. The best way to respond to this in the moment is to stay calm, document the concern, and notify your BCBA. Your job is not to explain or defend, just to respond with professionalism and report it appropriately. So that's what you would need to do in that moment. Okay, last one. Lately, you've been feeling overwhelmed. During a recent session, you snapped at another RBT when they offered you feedback. You've been quiet in meetings and feel frustrated but haven't told anyone. What is the most appropriate next step you should take as a professional? So, I'll give you a few seconds to read them and respond. Okay, so the correct response would be C, reflect on your behavior and request a private check-in with your supervisor. Owning it and asking for that support is professional, and it helps everyone in the situation. So making sure that you're not taking it out on others. If you're telling the RBT you were tired and they were being sensitive, that's not a good team dynamic. Talking about the other RBT's behavior with a coworker to relieve emotions, also not a good dynamic. And ignoring the tension, you might think is a good idea in the moment, but overall, that burnout isn't going to go away until you talk to someone. So going to your supervisor is the best situation, the best answer to the situation. Okay, when in doubt, use this flowchart. It is in your handouts. So you will also have a copy of this on its own if you can't read it very well right now. But practically what you're doing is identifying what the conflict is, using the matching strategy from your handout, escalating to your supervisor if it continues, following up to make sure things are staying on track, and yeah, getting some feedback. There's a lot in here, and depending on the conflict, you'll know which ones to, what you'll need to use. But this is a good general like process from start to finish, and it'll help you with any conflict for inside the ABA clinic. Make sure that you're keeping this somewhere where you'll actually use it, because it's definitely beneficial. Okay, just to wrap up, conflict does not mean something is wrong. It means that we're working with people. Your job is to handle conflict with professionalism and empathy, follow our process, and always lean on your support team when it's needed. Remember, your BCBA is always here to help you, and thank you for listening to this. I hope you got something out of it.